We can begin.
Hello, everyone. My name is Dr. Antoine Salvador, and I'm a professional psychologist out of Massachusetts. I currently work as an outpatient clinician in a hospital setting, and I'm also teaching faculty at William James College. Hello, everyone. My name is Dr. Antoine Salvador, I've had the honor of being a long-term partner of Propeller, leading several of their D&I, all-agency, and leadership trainings and monthly discussions. One of my many passions is raising awareness and supporting the needs of people of color, and I'm honored to be here today on behalf of Propeller to facilitate a discussion on dermatology for patients of color. We've brought together some incredible panel of experts who are going to share insights on some critical issues in dermatology, like improving representation in the field and how professionals in every area of healthcare and healthcare marketing can work to better treat and connect with Black patients. I'm looking forward to a thoughtful and informative discussion and how we can champion diversity in skin and truly achieve equity in care. As we know, being intentional and deliberate about raising awareness are critical. I would love to start our conversation off with some introductions of the great panelists that we have here today with us. Each of these dermatologists come to the conversation with extensive experience working with skin of color, and we are so excited to hear from them today and have them shed some light on this topic. So, Dr. Lester, if you're able to start us off, that would be great.
Hello, my name is Jenna Lester. I'm an associate professor in the Department of Dermatology at University of California, San Francisco, where I also direct the Skin of Color program, and in my role work closely with medical students and residents who are trained, some of whom are training to become dermatologists, and work with many patients across the race and ethnicity spectrum, but in particular in my skin of color work, focus on caring for diverse patients and taking care of their specific needs.
Dr. Bachi, if you could go next.
Absolutely. Well, firstly, thank you so much for having me here today on Black Health Now. I'm excited about this topic and to join you in raising awareness. I'm an associate professor of dermatology at Boston University, where I'm also an attending dermatology physician at Boston Medical Center. I started our Skin of Color Center in 2012. It was one of the first in the country at that time. Very excited about that and very proud. Since then, I'm also have become the cosmetic director here at Boston University. I train residents and also teach medical students and international trainees as well here.
Thank you. Thank you so much for that. And last but not least, Dr. Miles.
Thank you for having me. I am a dermatologist, board certified. I have my own medical practice, which I started in 2014. I'm also an associate professor at Ross University, and I train medical students and also residents in dermatology. And I'm so excited to be here so we can talk about solutions.
Great. Thank you so much. And thanks again for joining us. As you all can see, we have a great panelists with us who are lending their expertise, and we are so excited to begin and have this conversation. So let us get started, and I'm happy to learn more with all of you today on this call. So it would be helpful to start our conversation with understanding the issues that Black and Brown dermatologists experience. And Dr. Lester, could you speak to this and what inequities or biases you have seen or experienced regarding brown and Black skin in the dermatology field?
Sure. So I think, one of the main ways that this is reflected is in what we see in research and the disparities that have been investigated in terms of patient outcomes. So, for example, when we look at a condition like psoriasis, we know that Black patients are less likely to be offered biologic therapy, so systemic therapies to treat their psoriasis. In acne, we know that Black patients with Medicaid are as two separate groups are less likely to be treated with systemic treatments. Patients with Medicaid are less likely to be offered any treatment for acne at all. And so, the list really goes on. There are examples of this for almost every disease state that you could think of. So there are lots of issues there. And I think that it's very clear with those examples how that could have an impact on someone's ability to get control of a particular condition. I think what's more nuanced and there hasn't been as much inquiry into this is just how patients are treated in general when they're in a clinic visit, and that's in dermatology, that's in other fields too. I think that looking at the diseases is one way to get to tap into that issue. But just from what I've heard from patients, there is a very wide range of experiences reported when they talk about prior dermatology experiences and experiences in medicine in general. And so I think that is something that I'd be interested to learn more about over the year in subsequent years, and hope that we'll see more research reflecting experiential data.
Absolutely. And it's clear that this is a real concern. And as you're saying, we look at disease and we look at the experience, and those are different from those who are not brown and Black. And so how can we as a society work to better address these concerns?
Well, I think the first step is clearly delineating what exactly is happening. And when we see that there are disparities in how people are treated for particular conditions, psoriasis as an example, taking a step back and trying to understand what are the structural reasons why this is happening. And I think one thing that's been identified is one of the ways that we grade the severity of psoriasis, something called the PASI score, that in one aspect of it looks at how inflamed the skin appears. When we're educating people about observing inflammation, it looks different on brown skin. And as a result, I think that is one area that has been identified that could be the reason that patients of color or Black patients are not being offered these therapies at the same rate. So I think really taking a step back and not just addressing this particular problem, but looking for structural or systemic problems that downstream have the impact that we're looking to change.
Right. So like you're saying, we need to understand why this is even happening. And we also need to highlight that there is differences. One thing that you are saying that makes total sense is that those with a lighter skin tone or a white skin tone are not going to, their concerns are not going to show up the same as they would in colors of skin. And so it's important that I guess everyone realized there is a distinction in between those two. I think that's what you're getting at, right?
Yeah, I think similar to how the analogy I guess I would offer is, women with symptoms of a heart attack, it manifests totally different than in men. So it's the same disease condition, but it took years of research to figure out that there are differences in how that disease presents. And I think it's not harder to determine this. It's just you have to learn about what the different signs are. And similarly, in dermatology, there are different disease manifestations that often have to do with how color appears different in different skin tones. And many will say, well, it's harder to see. I don't quite agree with that. I think that it is different. And as someone who, and I wonder what my fellow panelists think about this as well, because, as people who see a lot of darkly pigmented skin, I think it's fairly easy to see. And I think it really speaks to the importance of exposure to varying skin tones so that you can really develop the eye.
Mm. I don't know if anyone wanted to add to that, but I love I just wrote down the quote that you had, like, it being different doesn't mean that it's harder. And so if we just have the knowledge and the exposure to those different types of skin tones, then we'll be able to identify these things in others who have darker skin or brown and black skin. Thank you. Oh, were you going to say something else? Sorry.
I just wanted to add that is just very important. Skin of color is different. It's still skin, and we have to think of it as skin, regardless of your complexion is skin, and diseases will present or look differently in different skin tones. And it's not wrong, it's just different, and we have to accept that and train on that.
Mhm. Absolutely. Absolutely. Thank you for that. And so the next question I have is for Dr. Vashi. What specific unmet needs do you see in the dermatology field, and when it comes to advancing it?
I would like to first reiterate what my other panelists were saying. I agree. Exposure and experience and awareness, right, can make us all better physicians, better collaborators, better dermatologists, and just better, are able to better support our patients in that way.
Mm-hmm.
Yes, there's definitely a lot of unmet needs, gaps in the field of dermatology. So as we're here discussing, we clearly know that there's these racial disparities. It's ingrained within our healthcare system, and that is inclusive of the field of dermatology. So there's gaps and there's inequities, but they don't always occur. They don't occur in isolation. It's very systemic. So there's different, unmet needs. One or gap, that's our workforce is number one, or one of them. The dermatology workforce doesn't really mirror the population that we are trying to serve. For example, Black dermatologists are maybe there's a few papers out there, but it's probably around 3 to 5% of total dermatologists. But of Americans, over 13%, 13 to 15% are Black. So there's that discrepancy. And then there's another unmet need, or a need, is just we have this lack of diversification in our education system. So, from even baseline education, there's this need for increased representation of skin and color in our dermatologic educational materials, just like Dr. Lester was pointing out, that we need exposure and experience, and one of the ways to get that is through our textbooks and what we learn upon. And then research, I think that was already touched upon, but skin of color representation in clinical trials is overall lacking. There's been several studies that have looked at that and shown that there's just a lack of representation. And there exists a need to diversify research to include participation of people of color, and then also so not only just to include more subjects or patients who are of color, but also to increase the breadth of studies to include some of the conditions that disproportionately affect our skin of color population, such as hidradenitis suppurativa. So I think those are just some needs that we see out there: our workforce, our education, and research.
Thank you for that. And so just to summarize what you were saying, so it really is about the lack of representation that there is in academia in general, but also the lack of representation of the students and those obtaining these degrees that are trying to enter these fields. And so one way of closing that gap is to change that. And so how do you believe pharma can help close these gaps?
Yeah, I think, us as dermatologists and trained professionals who have expertise can definitely close these gaps and help fulfill these unmet needs by partnering with pharma. And even just like you were mentioning, a lot of it is the students and the trainees that come about. So, mentorship is a big thing. So I think that pharma can, they can partner with organizations to promote and support educational efforts and research and mentorship programs. They can also help by partnering with those who are already, like some of us here, embedded in research programs or just programs with certain types of outreach efforts like Black Health Now. And then collaborations with pharma really do offer actually a great way to combine different and complementary resources to develop, strategies then to overcome different kind of barriers that we have to treatment and just getting out there to underserved populations. And then also pharma-driven clinical trials is huge. And, if they're promoting disease understanding and treatment like psoriasis, hidradenitis, suppurativa, that really adds to our ability to properly treat these diseases that affect those with skin of color disproportionately in terms of both incidence and then severity. So I think if, we can partner with pharma in a lot of different ways, just through, simple education efforts or big clinical trials that are including more people of color, or actually focusing on diseases more so that affect those of skin of color.
Right. So exactly what you're saying. So pharma can have more driven clinical trials and include those of diverse backgrounds in these trials. So then the results can be more inclusive. Absolutely.
Can I just elevate something else that Dr. Vashi was just saying, specifically about clinical trials? I think it's incredibly important to make sure that the participants in the trials are diverse. But taking even a couple steps upstream from that, I think some of the reasons why these trials failed to do that is because in their planning stages, they're not included. They don't have a diverse sort of group of people designing studies, involving dermatologists, who take care of these patients, who may have specific insights that would be really helpful in designing a study. I think that is an incredibly important part of this pathway towards having more diverse study participants. So I think, again, it's important to look at this undesirable outcome that we want, that we're wanting to change. And instead of just focusing on that thing, thinking about all the structural aspects of that problem and what other things might be feeding into that problem that should be addressed.
Right. So it really sounds like you're saying from the very beginning, we need to be more inclusive, and it can't really just happen at the end or try to work our way backwards. We really need to do it from the very beginning on when who are the researchers, who are the dermatologists, who are the people starting all of these things, and are we making sure that it is an inclusive and it is diverse with that, and not like a homogeneous population.
Right. Yep, and engaging skin of color experts as PIs for these studies as well. I think there are a lot of people out there who are really interested in becoming more involved in clinical trials, and yet we see whose sites are eventually chosen to participate, and then we wonder sort of why there's less diversity. I think that's an area that can be improved upon too.
Yeah, and it's one of those things where people don't know that if this is out there, then maybe I would want to join. But if it's not promoted to me, then I won't know. And so I think that's great. One, spreading the word and making sure that we are getting that diverse population, but also letting people of color know, like, hey, you could also join these trials, and it would help.
Yeah,
Dr.
and I just
Miles.
wanted to add there as well what you just said. Patients, a lot of skin of color patients are nervous about participating in trials just because of the history of clinical trials, and people of color were not protected; they were taken advantage of. So, pharma could also have marketing campaigns about the benefits of participating in trials. So, I think that would be very important. So that way, yes, we want to have more African American doctors performing these trials, being principal investigators, and we also want to encourage patients to participate and to feel safe with participating.
Absolutely. Absolutely. So again, hitting it from all angles, making sure that we're making sure that it is inclusive, by all means. But to your point, Dr. Miles, how do you think we can encourage more people of color to pursue careers in dermatology and increase the representation in the field?
I think it really starts with the basics. So, education, having equal education from preschool all the way up to college. Um, your zip code shouldn't determine how effective and how comprehensive your education is. Um, if tax dollars aren't there, the schools will lack resources. So that's number one. Number
Mhm.
two, if you make it through that gauntlet of preschool and middle school and high school, make it to college, then to medical school, have mentorship programs. Like the National Medical Association has great mentorship programs. American Academy of Dermatology has great mentorship programs for students, medical students, to pursue different careers in dermatology, to raise the awareness of this specialty. And once someone is a resident, to support them as a resident. Um, I've worked with a number of dermatology residents who have had difficulty in residency, so having support for that person. I also am a member of the National Council for Residency, and that helps to supply support for these residents once they are in a program. And I think that there can be summer programs for residents and for students, so that way they can learn about different specialties in medicine, to get them aware and excited about careers in STEM and medicine. So I think building awareness is the most important thing.
Mhm. And like we were saying earlier, it seems that like a lot of people don't know what they don't know, right? So like this could be a field that some people are interested in, but they don't know that like them too can also do that. But hopefully, with them seeing our expert panelists, the representation is there. And as we continue to build that, I'm hopeful that more people will go towards this. And we are definitely speaking about systemic and institutional racism that is happening, because like you're saying, this is what's preventing some people from being able to achieve these, and move forward. So like we're all saying, it starts by becoming aware of these things, and like all of you said from the beginning. And I like what you said, Dr. Miles, about even taking it to pre-K, right? Like even taking it way before they even hit medical school, that we need to start making an inclusive, and start having some equity in those things, so there can be changes. Um, I also wanted to mention that from my background, which is clinical psychology, that training and mentorship, training and mentorship are the number one factors to help with brown and black students pursuing degrees, but also just pursuing their further education. And so if we can have those mentorships and we can have those trainings, it's only going to help people even more. And sometimes they're seeking those things from people that are not even in their same field, or they're looking at other people that are not in the same places as them as mentors, because unfortunately it's so scarce. Um, Dr. Lester, were you going to say something?
Yeah, I just wanted to remark on how I think of a lot of the problems that we experience are very interconnected. So something that I remember and I think is not like a unique experience. A lot of people in medical school became got on the path for medicine because they were impacted by a physician, and they had a physician who they admired,
Mm,
and that it inspired them to pursue a career in medicine even before they knew necessary. Like often it's like, I want to be that type of doctor as well. And so I find it interesting that we know that Black patients access dermatologists less than any other racial or ethnic group. And so I think about how that could connect to, an eventual there's lots of reasons that that's a problem for immediate health, et cetera. But speaking specifically on this issue of diversity in the workforce and how a clinician can have an impact on someone early in life and inspire them to carry that forward as a career decision, addressing that issue of access can have like huge ramifications for that person's health, but also for our field in the future.
Absolutely. And just another point that representation does matter and is very important. So thank you again for shedding light on some of the inequities, right? Like we didn't go through the whole list as we said that exists for dermatologists. We know that patients often seek out doctors who they can relate to or who look like them and understand their unique needs, like you were just saying, Dr. Lester. Can you speak more about Black patients and how their treatment, care, and support needs to differ to be better support them? I know you were just touching upon that, but can you expand on that?
I think there are a couple ways that I see this show up regularly. I think one of the biggest things is, and this is not an exhaustive list, but one of the biggest things is care for hair and scalp. And that is a place where I see a lot of patients coming to me having had treatment regimens offered to them before that didn't work. And it's one of the main areas where just sort of a boilerplate, like use this shampoo and use this cream or solution doesn't work. It really requires that the physician has a pretty deep understanding of hair texture and hair type and how it's different, what the unique the sort of the unique features of textured hair are, and how to adjust a treatment regimen to address that while still optimizing or improving someone's condition. So, I always joke that the fastest way to lose credibility with a Black person with textured hair is to tell them to wash their hair every day. And I think that still happens very frequently. So I think that's a big way. Another way I see this show up is very cookie cutter discussions about the importance of sunscreen and why it's important. So we know that melanoma develops in Black patients independent of UV exposure, and that is because acrolentigenous melanoma is more common in Black patients. That's more likely to occur on the palms of the hands or the soles of the feet and in the nail beds. And these are not areas that we think of as sun exposed. So to tell a Black person to wear sunscreen in order to prevent melanoma, which is what we tell our patients with light skin, that is not the appropriate connection to make. Now, are there lots of reasons that I counsel my patients to wear sunscreen, Black patients to wear sunscreen? Yes. But I think it's really important to be nuanced in that conversation because I don't want to misinform them, and I don't want them to think, I am as likely to get skin cancer or melanoma from UV exposure, and miss an opportunity to tell them, actually, you should be looking in these other places of your body when you're sort of thinking about prevention and surveillance. So I tell my Black patients all the time, wear sunscreen, because pigmentary disorders are something that patients with dark skin experience and is very, very distressing and has impact on psychosocial health and is incredibly important to treat aggressively. But I think that is a nuance in the conversation that I did not necessarily learn early in my residency, that we should be tailoring for the different patients that come through the door.
Yeah, and I just
Absolutely.
wanted to add, I'm sorry, I just wanted to add just with hair, that is super important because a lot of doctors just do not have the cultural awareness. Ask me, I touch your hair before you do the examination. Um, Definitely don't wash your hair every day. You can't prescribe that because that's not, you can't, a Black person does not wash their hair every day. Just having that cultural sensitivity and awareness understanding different hairstyles, understand about braids and locks and different styles, ponytails, wet set, to have that knowledge. And those are things that are lacking in our residency programs that teach people about the different styling practices of African Americans.
Absolutely. So it also seems a big takeaway I got from that was not to practice outside your expertise, right? So if you don't know what you're speaking of, like you shouldn't then be speaking on those things. But then to also generalize those treatments are also not okay, right? These like cookie cutter type of treatments, like washing your hair every day or just putting on sunscreen. Like, yes, there are positives, but there are not the same reasons why somebody with lighter skin needs to put on sunscreen versus someone with darker skin.
Yeah. And I just want to reframe one thing you just said, not practicing outside of your expertise. I think the alternate framing of that is we all have a responsibility to care for all patients. So if you feel like you are stepping outside of your expertise when you're talking to a particular person, just like if you feel like you're not up to date on the most recent treatments for psoriasis or acne or eczema, you need to go to a knowledge source and look and make sure that you're staying up to date, because I think that these are educational pearls that we all need to have and that exist out there, and that are there are experts that can teach this. And so I don't think not knowing is an excuse to stop there, because we're all clinicians and lifelong learners, and we should be continuing to add to our knowledge base.
Absolutely. And so with that being said, I wanted to ask Dr. Bashi, how do you think we can help dermatologists, especially those who are not Black or brown, do a better job in diagnosing, treating, and providing better culturally competent care for their Black and brown patients?
Yeah, absolutely. And I think Dr. Miles and Dr. Lester have already touched upon this a bit, that it's incredibly important to provide culturally competent care. I'm in Boston at Boston Medical Center, the largest safety net hospital in the New England area. So I take care of patients from a lot of different backgrounds. So I think it's a really important step for any physician, dermatologist, to acknowledge that there are different cultural differences, just as we were just discussing with hairstyling, is to keep an open mind to other practices that may not be our own, and to just show empathy for whatever someone is going through. And so I do think as dermatologists, we must work harder to better understand and then acknowledge different social and cultural norms, just like Dr. Lester was just saying, that if we don't have the knowledge base, we should go out and find it and educate ourselves so that we can provide care for patients that is trusted and it's quality healthcare. A big thing for me is I take care of patients from a lot of different backgrounds who speak different languages. So, it's important that we speak our patient's language. So we should have well-qualified interpreters to accommodate linguistic differences and educational differences. Often we can use visual aids like illustrations that can help to communicate with our patients, using illustrations to show diagnoses and treatments. And then also, I think it is important we need to understand and then accommodate these different situations. Just like we were talking about hairstyling practices, because that will often determine the outcomes and the overall health of individuals. So, this can range. So sometimes it's just failing to recognize sociocultural factors. Like the number of times, people may wash their hair a month. Then that can kind of determine the prognosis of something or formulating a treatment plan. So it's important not to ignore those different cultural perspectives. And just like Dr. Lester was saying, melanoma and also non-melanoma skin cancers, yes, they are less so in skin of color, but they also have a poor prognosis for people from ethnic minorities. So Black patients who are diagnosed with skin cancer, they still do get it in those certain areas, palms and soles. They're usually diagnosed at later stages than people from other racial groups, and it could be just a lack of awareness that that is where it could be occurring. That is where one should be looking. So acknowledging that these groups don't get cancers, advancing or advocating for skin cancer awareness campaigns then that include skin of color that can, really help navigate, how we diagnose and how we treat and when a patient will come to us to seek care. And again, always like to talk about this hair care practices. Scalp disease treatment should be tailored to one's own typical hair care practice rather than a catch-all plan or cookie cutter plan that was also mentioned.
Right. And so here you are saying again that like this generalized cookie cutter treatment isn't going to work. And so having more tailored treatment is really what needs to happen when we're working with our patients of all backgrounds, but especially those of brown and Black skin. And so with the goal of gaining and growing cultural competence, it seems like in all fields, the first step is to understand the problem and to educate others in the field and those supporting the fields on how to better address these inequities is the awareness piece, right? And on the journey of cultural competence, we're always constantly learning. It's not like we all become culturally competent experts after taking one course or doing one workshop or viewing one Black Health Now segment. That it's important that we are constantly trying to achieve full cultural competence. And it's just one of those things that we're just going to have to keep working at. And so I'm sure there are those like myself on this call who are new to learning about some of these inequities. And I'm wondering, and I'm sure that they're interested in learning more. And so I'm wondering if Dr. Lester, you could share your favorite resources for staying on top of these issues and really understanding what you and your patients of color need. And I know earlier you mentioned certain organizations that you were part of to keep on this, and maybe sharing those again or other ones that you utilize.
Yeah. I think it's hard to think of I don't know, when I think of cultural competency or cultural humility, and when I think of the task that we have at hand, it's really at its basis is really about a recognition of humanity in another person that's possibly different from us, or is the same as us, but is different in certain ways. Like I think this recognition of humanity is something that it's hard to boil down to a resource or like an organization to watch. I have some ideas there, so I certainly will share that. But I just want to start by recognizing that, and to say for that purpose, possibly the best thing to do is to engage with communities that you're looking to help. I think my patients are always the people who give me the best insights, because I'm still like part of the medical establishment, and there are blind spots that I have as a result of that. So
Right.
when I'm looking to help a patient, even if this patient is someone who's also Black and we have many shared experiences, I think hearing their perspective and understanding the challenges that they have as someone who's not as a part of the medical like system is really important. So I would encourage everyone to seek people first, and seek connections to the community as a way to elucidate some of these challenges and things that we're trying to overcome. That being said, I think there are organizations that are doing this work and can be helpful in starting, if someone who's like sort of starting this their journey and awareness of these topics. I think possibly all of us are part of the Skin of Color Society, and that's an organization that is championing this cause in so many different ways, from mentorship to, working on the issue of diversity in our workforce, to working on issues of diversity in clinical trials. So that is an organization that I really hold in very high regard in terms of how it's really bringing programming on these topics to a broad group of people. So they have a website, and they do have publicly accessible aspects that website for disease education, etc. But they also have membership only areas of access that provide even deeper knowledge and educational curriculum on particular topics in dermatology.
Great. Thank you for sharing. I want to open it up to Dr. Bashi and Dr. Miles. Do you have any resources that you utilize or you would like to see more of or share with us?
I would echo Dr. Lester's statements on the Skin of Color Society. I think it's a really great society. I was part of the board. I just came off of it in 2023. There's lots of different learning modules, videos. They have, it's called Dermatology E-Learning and Equity Platform, DEEP. And there are videos that can be viewed for furthering one's education. There's also patient education handouts. And so those are really great that we can use as dermatologists to give to our patients. They have a task force that's looking into how to help, diversity and diversify our clinical trials. They do a day-long symposium yearly on that. So I think there's a lot of also initiatives to incorporate more skin of color images and textbooks and online resources. So I think that's actually a great platform to see what kind of is being done and what's out there, and navigate through that.
Yeah, and I just wanted to add that there is a website, so online website, Visual Diagnosis. And I like this website because I feel that they have made it an intentional goal of the goal of their website is to include all skin types. And I think it's a very good website. I have my students look at it. I even show my patients, this is what you have. Because when we look in textbooks, most of the time we're going to see lighter skin types. So I like Visual Diagnosis because I think it helps the patients feel, yes, this is a diagnosis that I have. It looks like me. And the students, they get to see skin diseases in all different skin types. So that's a very important platform as well.
Thank you. And of course, that's so helpful to understand and how we can continue our learning beyond this time spent here today. And also how all areas of healthcare spaces, healthcare providers, marketers, pharmaceutical brands can communicate with patients of color and even the doctors that treat them to ensure that they have better care. And those, again, are all great examples. And I'm hopeful that at least this is a start in the long journey of becoming more culturally competent and aware in this field. Unfortunately, our time is almost up. So I would love to leave this conversation by hearing your takeaways. What do you want everyone listening to leave here understanding, and what is the message you really want to get through to those on the call today?
I like to say that our differences make the world go round, and everyone's difference is unique. And I think we should embrace that. And I think with marketers, with pharma, um, reaching out to different populations, I think we'll get a better response and more people will be open to participating in clinical trials. And I think with having more diversified diversity and with doctors and the clinical training, I think those are good starts.
Great. Thank you.
I can go next. Yeah, I think this is such an important topic. And I guess my take home point from this would be that no endeavor, whatever we do, is too small, whether it be by way of education, awareness, projects, research, mentorships, big or small, we are all, well, however we work or do, we're uniquely positioned in some capacity to make some sort of an impact. And I think by working together, collaboratively, raising awareness, like this Black Health Now issue, I think we will be able to achieve maybe hopefully a shift in mindset that can enable our healthcare system, our dermatology system at large to move toward just a more just and equitable future for everyone involved.
Absolutely. Absolutely. Thank you, Dr. Rashi. Dr. Lester?
I just want to emphasize the interconnectedness of the provision of healthcare. It's not just about the physicians who are in front of the patient. It's not just about the nurses and medical assistants and physicians' assistants that the patients also interact with. Pharmaceutical companies, marketers play a significant role in disrupting messages that could contribute to disparities or perpetuating them. And I think I would encourage everyone on this call to think about that as they are, going about their day-to-day work, and continue to ask yourself, in this message, in this campaign, who is helped and who is harmed by this? And how could this potentially work to mitigate disparities or perpetuate them? Who else can I ask to help answer that question? Who can I call into this conversation to help to address this? And what gaps in my knowledge can they help me fill? So I think this is a collective effort. This is a team-based effort. We didn't get here alone just because of one person's actions, and we really need to work together to get out of this situation and offer everyone the best care possible.
Absolutely. That's profound. Who is helped and who is harmed by this, and making sure that we're aware of those things, right? And as we know, it all starts with awareness. So it's kind of, we can't even begin to make these changes if we don't know what changes we need to be making and where it is to start. So thank you all again so much for that, Dr. Miles, Dr. Lester, and Dr. Vashi. The insights you shared today are invaluable. I know that they're going to help shape the future of dermatology and healthcare marketing. I know I've learned more about dermatology and can't wait to continue learning more with the resources that you provided. And I also wanted to say thank you for all our listeners for joining us. I hope we can walk away with some steps so we can take wherever we are in providing a more inclusive and culturally competent field. And thank you again to Black Health Now and to Propeller. And I'm sure if we were able to see everyone else, they would be clapping for the three of you. So I will be clapping for the three of you. And thank you so much for providing us with your time and your expertise. This was great.
Thanks for having us.
Yeah, thanks so much.